Kirk Jobe. I'm a neurosurgeon in St. Petersburg, Florida, and I've been practicing neurosurgery here in the area since 2005. I trained in neurosurgery at Rush University Medical Center in Chicago and came to Florida as I was recruited to do epilepsy, as well as practice general neurosurgery here in the city of St. Petersburg. So I've been here at Neurosurgical Associates at Tampa Bay since 2005, so that's 10 years in practice here. And then our training is typically 7 years, so I've been a physician for a total of 17 years practicing neurosurgery. As a practicing neurosurgeon, I typically take care of general neurosurgical problems, but I'm specialized in taking care of epilepsy as well as skull-based tumors. Epilepsy surgery is something that is a specific type of neurosurgical training that's applicable only at specific centers in the United States. We're happy to be one of 5 centers in the state of Florida that provide these sort of services. I'm also co-director of the Minimally Invasive Skull-Based Center, which deals with tumors at the base of the skull. And we have both minimally invasive approaches to take care of such tumors, where we can do the entire operation up through the nose, leaving the patient without any skin incision on the head. And if appropriate, some patients require either radiation or specific types of treatment that we can apply afterwards, after surgical resection. My goal for my patients is actually to share in their experience in healing, which means all the way from the beginning of seeing a patient in the office and spending the time to listen to them and hear what's actually going on, to deciding on a treatment plan for them that we actually decide together. And then from there, if it does involve surgery, once we take care of the surgery, I'll see them afterwards, and I'd like to see them all the way through, which means that if they've come to me for something as simple as low back pain, that in the end, I'm able to see them all the way through, so that they're leaving my office maybe within a week or even a month or two later, knowing that that problem is taken care of. And if it's not taken care of for some reason, then we continue to work on it, and I'm in it with the patient. I think our practice is a little bit old-fashioned in a sense. We still spend 30 to 45 minutes with the patient, and when they make an appointment in our office and come to see us, we're actually the person seeing the patient. We don't have assistants or anyone else seeing the patient up front. We are the ones seeing them, listening to them, and sort of figuring out what's going on. It's something that you don't get often in this day and age of medicine. So I think that's something that we have to provide to people that they may not find elsewhere. In addition, I think that gives us an advantage to actually determine what's going on with the patient and actually apply the right solution to the problem. It may sound funny, but as neurosurgeons, we actually don't always look to do surgery. We look for any solution to a problem, and oftentimes it's going to be taking a patient through either physical therapy, even pain management injections for if it's neck or low back pain, prior to any discussion of surgical intervention. So it's very rare, unless it's, let's say, involving a tumor or something that would need to have surgery right away, to see us and actually discuss surgery on the first day. It's typically a treatment plan that we come up with rather than just a surgical solution. I think patients coming to see us in the office will get a very personalized treatment from us, meaning that because it is us that they're seeing when they come through, they don't just get a cookie cutter, oh, you have this type of pain, we're going to give you that type of treatment. We actually see them, examine them, and over the course of the 30 or 45 minute visit, determine what's actually going on, and then go over the films with the patient, if necessary, to show them what's going on, and then with the patient determine what's the best treatment plan. Not every patient's going to want to, let's say, do physical therapy. Not every patient's going to want to do pain management injection. Some patients are interested in just looking at taking care of the problem, and everyone's a little bit different. So as opposed to other practices, I think we come up with a very tailored solution for each of the patients coming to see us.